Hello, I'm Dr. Nirupa, obstetrician and gynecologist at Akkineni Hospital. Hope you're safe and well. Today, I'll be sharing some important information. Stay tuned and take notes.
All right, let's dive into a topic that so many of us deal with but is often wrapped up in a lot of confusion: Polycystic Ovary Syndrome, or PCOS. Let's start with a feeling that I think we all know.
Right? How many times have we said that to ourselves? Oh, I'm just stressed. It's so easy to do, to just dismiss what our body is telling us because, well, life is crazy and demanding. But sometimes those little signals are pointing to something more.
This is a story that Dr. Nirupa hears pretty much every week. A young software engineer, super busy, had been missing her periods for over a year. She chalked it up to her job, her crazy hours, just modern life. But then something else happened. It was a symptom that really hit her confidence. Unwanted hair on her chin. That was the final push to go get some answers. And that's when she got the diagnosis: PCOS.
Now, this was the very first thing Dr. Nirupa said to her, and honestly, it's the most important message for anyone watching this. This is not some kind of personal failure. You are so not alone in this. And the best part? This is absolutely 100% manageable.
So all the insights we're talking about today come from Dr. Nirupa. She's a gynecologist and laparoscopic surgeon, and her whole thing is built on honest, simple, and fearless communication. And that's exactly how we're going to approach this topic together.
Okay, so let's start with the absolute basics. What in the world is PCOS? I know the name can sound kind of intimidating, but I promise you, the reality is much less scary. At its core, PCOS is a hormonal condition. It's not a disease. Think of it more like a collection of symptoms. That's what a syndrome is. And it's all caused by your body's hormones being a little out of whack. And that term, polycystic, it just means many cysts, which refers to these little fluid-filled sacs that can sometimes pop up on the ovaries and mess with your body's natural rhythm. Now check this out. PCOS affects 1 out of every 10 women across the globe. And in some places, like India, that number might even be a bit higher. What does this tell you? Well, it means if you have PCOS, you are part of a massive worldwide community. You are so far from being alone.
So we know what it is. But how does it actually show up, in your day-to-day life? Understanding these signals from your body, well, that's the very first step to getting back in the driver's seat. PCOS can look a little different for everybody, but these are the big ones. Irregular periods, that's usually the first major clue, but it can also show up as weight that's just really tough to manage, acne that won't quit, or even unwanted hair. It can even affect the hair on your head and just your overall mood. Just realizing that all these things might be connected is a huge aha moment for so many women. So yeah, these symptoms, they're not just random. They're all part of the same story, connected by something happening underneath the surface. So what's the engine that's really driving all of this?
And here it is. For up to 70% of women with PCOS, this is the root cause: insulin resistance. It's like a chain reaction. First, your body's cells kind of start ignoring insulin. So your pancreas goes into overdrive, pumping out more and more to try and get the message through. All that extra insulin then tells your ovaries to produce more androgens, which are sometimes called male hormones. And it's those high androgens that mess with ovulation and cause a lot of the symptoms we just looked at.
Okay, so we get the what and the why. Now for the most empowering part of all of this, the how. How do doctors figure this out? And more importantly, how can you actually manage it and totally thrive?
So there isn't one single simple test for PCOS. What a doctor will do is use something called the Rotterdam criteria. They're basically looking for at least 2 of these 3 main signs: irregular periods, signs of high androgens from either how you look or a blood test, and then seeing those little cysts on an ultrasound. It's all about putting the puzzle pieces together to see the big picture.
And that brings us to maybe the most crucial point from Dr. Nirupa. The first, and honestly the most effective treatment, isn't a pill. It's your daily habits. This is where you have an incredible amount of power.
It all really comes down to 3 simple but super powerful pillars. First, your diet, focusing on whole foods that help manage insulin. Second, regular movement. Even just a daily walk can make a world of difference. And third, sleep. Protecting your sleep is like protecting your hormones. Seriously, small, consistent changes in these areas can actually restore ovulation and get your periods back on track.
Now, of course, this doesn't mean you have to do it all on your own. Medications are out there and they can be incredibly helpful, but they're really seen as tools to support your lifestyle changes, not replace them. And this fits perfectly with Dr. Nirupa's whole philosophy of using the least amount of intervention you need to get the best result.
All right, let's talk about something that causes a ton of anxiety for women with PCOS, fertility. That fear of not being able to have children can feel really overwhelming, but I want you to know there is so much reason for hope. I just want you to sit with this for a second. This message is everything. Let me say it again. PCOS is one of the most treatable causes of infertility. A diagnosis isn't an endpoint for your fertility journey. For so many, it's actually the start of a clear, manageable path toward it. And that path is really well defined. It can be as simple as lifestyle changes or some medication to help with ovulation. There are other options too, like IUI or IVF if they're needed. And once you do conceive, there's dedicated monitoring to make sure you have the safest pregnancy possible. A whole system of support is there waiting for you. In her writing, Dr. Nirupa uses this beautiful Telugu term, amaigaru. It's a really respectful and affectionate way to speak to a young woman. And the message behind it is universal. You deserve to dream of being a mother, and you deserve to do it without fear getting in your way. So after hearing all this, you might be asking yourself, do my symptoms really count? Is it time to see a doctor? Let's make the answer to that super clear. Think of this as a simple checklist. If any of these sound familiar, it's a great reason to just book an appointment. Don't wait around for things to get worse. And that last one is so important. If you just feel like something is off in your body, trust that feeling. And in the end, it all comes down to this. Those symptoms, the missed periods, the acne, feeling tired all the time, they aren't things you need to ignore or feel ashamed of. They are your body's way of talking to you. The real question is, are you ready to listen and to start that conversation with a doctor who can help you figure out what it's saying?